Good morning, PT on Ice Daily Show. My name is Dr. Jessica Gingrich, and I am on faculty with the Pregnancy and Postpartum Division here at ICE. So today we are going to talk about fear-based comments in the postpartum space and how changing your own bias and fears will lead to better outcomes. So before we dive into that, we have many live courses coming up around the country, as well as our 8-week online course running most 8 weeks. So if that is something that you are looking forward to adding to your toolbox, head over to ptonice.com and sign up. So we have all heard the advice, don't go back too soon. Don't lift over 10 pounds. If you do, you will prolapse yourself. You will never do that again now that you're postpartum. And that's really only covering the surface of some of these comments that these moms are hearing. So I will say that I think that the fear-based messaging is improving. The comments are improving. They are still being said to postpartum moms. I am not here to point fingers at anyone, specific providers, because these comments come from all of us. I know that I have said fear-based things early in my career. So we've got medical providers, we've got moms, we've got grandmas, we've got your best friend's great uncle Ned, your neighbor that's had 4 home births. And the list really goes on and on. So the lack of knowledge leads us to err on the side of caution, and that can really make us say really scary comments that will lead postpartum moms down a lonely and really deconditioned path. And so today, the goal is going to be to change that narrative. And how can we get comfortable talking about symptoms and symptoms that these moms may bump into, getting comfortable talking about how strength actually really matters. We know that it matters in so many other populations. Why are we saying it's different in the postpartum space? So let's take a look at some literature. So we have a study that was done in 2019 by Lori Forner and colleagues. They looked at the prevalence of pelvic organ prolapse symptoms, and this was defined as a sensation of vaginal bulging in women who lift weights for exercise. I quote, physically active women lifting less than 15 kilograms, so that's about 33 pounds, were more likely to report symptoms of pelvic organ prolapse symptoms than women lifting greater than 50 kilograms, and that's about 110 pounds. So really the conclusion of this paper suggests that women who lift heavy for exercise don't have an increase in pelvic organ prolapse symptoms. And we know that pelvic organ prolapse severity and symptoms don't always match. Another study looking at heavy lifting during pregnancy by ICE faculty Christina Previtt and colleagues looked at 679 women who continued lifting 80% of their 1 rep max during pregnancy, continued exercising on their backs, and also used the Valsalva maneuver or bracing. There was no increased risk of complications. Those that experienced urinary incontinence during pregnancy had weaker pre-pregnancy numbers, suggesting that strength may be protective to the pelvic floor dysfunctions during pregnancy. Now, over half of these women did need some form of pelvic or postpartum rehab following birth, but that's to be expected. We know that should be the standard of care. We also have literature around diastasis recti. We do not have an agreed upon definition of what constitutes a diastasis, but we do have literature supporting core strengthening to potentially improve width, depth, and function. Hills and colleagues published a study in 2018 looking at the differences in trunk muscle function and self-reported pain and low back dysfunction between women with and without a diastasis recti at 12 to 14 months postpartum, and if they relate to that interecti distance. So they looked at women with a diastasis, and that was in this particular study defined as greater than or equal to 2.2 centimeters. In women without a diastasis, which was defined as less than 2.2 centimeters, they tested maximal trunk flexion, extension, and rotation torque generating capacity, a sit-up test, sitting to rising test, which is the ability to sit from the or stand from the floor without using your hands, and trunk flexion endurance and lateral flexion endurance testing. They measured pain and disability with the numeric pain scale and the Roland-Morris low back pain questionnaire, respectively. They found that women with a diastasis recti, so in this paper, greater than 2.2 centimeters, had significantly lower torque generating capacity and a lower sit-up score than those without. Again, all roads leading to getting mom stronger. So how does this relate to symptoms like urinary incontinence, heaviness, vaginal bulging, and abdominal coating in the postpartum timeframe? And how can we be better about our messaging and encouraging exercise? So we know that there's a healing process, even for moms that don't have perineal tearing or episiotomies, because the pelvic floor muscles stretch up to 300 times their original length during childbirth. So early symptoms are to be expected. And saying that can be really helpful. Hey, when you get up out of bed to go to the bathroom, you may leak a little bit in this really early stage of postpartum, and that's okay. So with the literature that we talked about earlier, we are seeing that strength matters. We know strength matters in every other muscle in the body. So why are we suggesting that the pelvic floor is any different? We are seeing it in literature, and we are also seeing it clinically. So when you are in the clinic with your postpartum moms, you should be educating on 4 buoys or guideposts as they start to return to IADLs, ADLs, and exercise. Those 4 buoys, you've probably heard this before. Urinary incontinence, when you're talking to your patients, say peeing in your pants or leakage. Feeling heaviness, pressure, dragging, or a bulging sensation in the vagina. Pain, and then an increase in bleeding in that early postpartum phase. These symptoms are markers for her to watch for during physical activity and exercise. Now, I want to be very clear on this. This is not if you are experiencing symptoms, stop immediately, go sit down and call me because now we are really concerned that we're ruining your pelvic floor. The conversation looks a little bit like this. We are going to start adding some exercise into your day. I'm going to give you 4 things to watch for: peeing in your pants, feeling heaviness in your vagina, pain anywhere, and if you have an increase in bleeding. If you experience any of these, that is to be expected, and it's okay. We may bump into these symptoms. You are not ruining anything. They are just symptoms that are telling us that we are getting to a threshold that is fatiguing to your pelvic floor muscles. So if this happens, it's totally fine. Here's how we manage them, ... I also go into being aware of what round you're on, how many reps you were doing, how much weight you were using, and what movement. And so talking about these different things, and then how can we give them exercises to modify so that they continue to get a good workout at a very similar stimulus. When the postpartum time comes, it can be a very vulnerable time with lack of sleep, lack of self-care, postpartum depression and anxiety, and the list goes on. So giving mom her buoys and guidelines is going to help her feel more confident in moving her body. It's going to give her a lot of freedom, and it's going to really help her physical health as well as her mental health, and giving her a sense of control, probably something that she feels like she's lost a little bit of. So we need to encourage women to lift. We need to encourage them to lift prior to pregnancy. We need to encourage them to lift during their pregnancies. We need to help build confidence in their ability to get strong and build their confidence in the way that they look and the way they feel. Educating them on what estrogen does to their muscles and bones, and that when they're in that early postpartum phase, their estrogen is low. And the way that they're feeling may be hormonally related. We need to be talking about how food is fuel. What do other forms of protein look like? We need to get them connected with providers in your area that will help build such a strong foundation for them that no one can crack or bring mom down. We need to start leading from the front. We are in such a unique position where we see women early postpartum and we can really get them connected to the providers that they may not think that they need, like a dietitian or nutritionist, like a lactation consultant, and a good one, maybe one that's not even in the hospital, maybe someone that they can go see outside of that. So to recap, we have strong evidence and plenty of clinical experience suggesting that strength matters in pre-pregnancy, pregnancy, and the postpartum timeframe. The buoys consist of leakage, pain, heaviness, and an increase in bleeding. And when we give these buoys, we need to give it with confidence, not fear. As always, I'm going to end this podcast with a quote from the great Ruth Bader Ginsburg. Women are not fragile like flowers. They are fragile like bombs. So let's freaking go. Have a great Monday. I'll see you next time.